Monrovia has grown tremendously. It's a vibrant city, it's a vibrant commercial city, and it's certainly not the city I left many years ago.
Dr. Janice Cooper and her family fled to the United States in 1990 after being held captive at the beginning of Liberia's Civil War.
Knowing that the trauma that I experienced was fairly brief in nature compared to people who have been through 15 years of civil war, I can absolutely relate to the impact of trauma on individuals in this country.
That intuition, combined with years of training in the field of mental health, come in handy as Cooper, project lead for the Carter Center's mental health initiative in Liberia, works closely with the Liberia Ministry of Health to craft a new national mental health policy and expand mental health services.
Liberia represents a clear challenge in global public health. It's a country that has fought through tremendous adversity and is coming out of that adversity now. Liberia has only one practicing psychiatrist for 3.4 million people. They were exposed to a brutal civil war of a prolonged period of time. Mental health is a priority, as stated by the government, and the timing is right to provide that help as they're beginning to rebuild the health sector.
The ministry has talked about and is very aware that they need to engage schools, they need to engage traditional leaders, they need to engage every sector of society.
And Cooper is involved in every step of the center's initiative, working with in-country partners to develop a curriculum to train local nurses and physician's assistants, advocate for the rights of people with mental illnesses, form family support programs, and tackle stigma and dispel myths about mental illnesses.
You have the notion that somebody that has seizure disorders, such as epilepsy, actually has mental illness when in fact they have a neurobiological condition. And you have the myth that those conditions can be caught or contagious. You also have the notion that people have mental illness as a result of being witched or that there's some witchcraft or treachery going on. You have the notion that people become mentally ill because they may have eaten something. So these are all ideas that with education we can dispel.
Her work takes her to rural outposts in Liberia and to parts of Monrovia most visitors will never see.
Substance use is a comorbidity with mental illness in many, many cases. And this is particularly acute in Liberia because there are no treatment centers for substance abuse. Let's go. So we went to Logan Town to see individuals who were addicted, living in a community in the worst conditions possible, and really emphasizing the need for mental health interventions and interventions for behavioral health, including substance use addiction.
So what we want to hear from you is, do you find any treatment? And when you don't get treatment, what do you do? And how is somewhere like a counseling place helping you? What are some of the things you think you will need for help? These are the things we want to be able to talk to other non-government organizations such as the Carter Center to try and figure out how we can help the government to help people here. That's why we are here.
And Ms. Carter.
Janice Cooper is clear about why she's here.
Mrs. Carter and the mental health program at the Carter Center, it's all about changing policy and having policy make the lives of people with mental illness better. And so finding a way to do that in Liberia was exciting for me.
I'm so excited about it.
When you have a climate where people are hungry for the information, they're hungry for the resources, and they're so willing to commit, it's very easy to understand how we think we can do it.